patient. That's not like in trauma or children. The majority of the causes of cardiac arrest in trauma in children is not ventricular fibrillation, pulseless VTAC. It's brain anoxia, airway obstruction, and hypovolemia. This is what we're going to talk about. The signs, which I'm sure you've seen in airports, train stations, and many places in the world now, may vary, and they're not unified. But generally will have the word EED on them. EEDs may look different. The colors may be different. The shapes may be different. But the principles of operation is exactly the same. And thus, we would like to tell you the 4 steps that are to operate an automated defibrillator. Obviously, the automated defibrillator will not be immediately available, so this does not cancel CPR. You have to start CPR. Then you open and switch on the defibrillator. When you do that, this defibrillator will start talking to you. So follow the instructions is step number 2 of using a defibrillator. It will tell you to apply the pads. Please remember that the pads have got sticky adhesive that you must put on the patient. In a study in the United States last year, 27% of the public did not even remove the clothes of the victims. Another 25% did not put the adhesive on. This shows how they look. And then once you put that, it will tell you not to touch the patient, and it will instruct you if it's a ventricular fibrillation. It will analyze the rhythm and instruct you to press the button if it's a shockable rhythm, or not to press the button if it's not a shockable rhythm. The accuracy of approved automated defibrillators is over 90%. It's more accurate than majority of average physicians and nurses. I think this is the very quick presentation about AED. Now we will move as a faculty to demonstrate first an in-hospital cardiac arrest with the manual defibrillator, which is the first table, and then we'll demonstrate the automated defibrillator.
You'll demonstrate, you'll put the screen, right? Okay. So now we don't want to block. لا هي جبته.
Okay, Dr. Muhammad, you're the team leader of this group.
Yes.
You're an accident and emergency, and can we be quiet for a second, please? A 60-year-old man comes in with complaint of severe chest pain. He is not attached on monitor.
Okay.
Switch off the defibrillator.
Well,
switch off the defibrillators. He's not attached to a monitor, and the nurse is starting to take his name and details once he seemed to lose consciousness, and you called in.
okay. So 60 years old, chest pain, and he just collapsed on arrival to the emergency.
Yes.
Right? So I'll approach and check my safety.
It's a safe.
Okay, then I'll shake and shout, "Are you all right? Are you all right?"
He's not answering you.
No response. Help, please. Come help me. I have an emergency. Open the airway, hit tilt and chin lift. Clear the airway. Is the airway clear?
The airway is clear and patent.
Okay. Counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Is there breathing?
There's no breathing, and
there
there is no pulse.
Is there any signs of life?
None.
Okay, guys. Can you activate the cardiac arrest team and come back? Start chest compression, please. Start ventilation. 30 to 2. And let me know when the defibrillator arrives, please.
Okay, the defibrillator has just arrived.
Good.
Okay. Okay, it's okay.
Okay. Would you stop, please?
Put the pads
Chest
on.
pads.
The gel pads?
This is pulseless ventricular tachycardia.
Yes.
Shockable rhythm. I'm going to shock. VTAC. I'm charging at maximum. I'm clear. Stand clear, please. Everybody clear. Shock. Resume chest compression, please.
Okay, one
No
shock is given.
No change in rhythm. Intubate and ventilate. And check your tube. Start an IV line. Connect him to the monitor.
Okay, this is pulseless
And chest
ventricular
compression.
tachycardia. It's fast, it's regular, and the QRSs are wide. 2 minutes
For
over.
2 minutes.
Yes,
Okay, stop please. 2 minutes. Tell me when the 2 minutes are over.
finished.
Okay, stop please.
This is the second shock.
Still in VTAC, pulses VTAC. I'm charging at maximum. Clear, please. Everybody clear. Stand clear. Shock.
Still in VTAC.
No change in rhythm. Continue chest compression and ventilation. And prepare adrenaline, 1 milligram, 1 in 10,000. And before the 2 minutes, give it and flush it, please.
Okay, 1 minute is over. 1 minute and a half is over. Nearly 2 minutes.
Adrenaline, please, given. Stop chest compression. Still in pulses VTAC. I'm charging at maximum. I'm clear. Stand clear. Shock. Third shock. Resume chest compression and ventilation, please.
3 DC shocks, and the patient is still in pulseless VTAC.
Now prepare amiodarone, 300 milligram and D5W, 20 cc, and infuse slowly. Tell me when the 2 minutes are over.
Okay, 2 minutes are over.
Stop, please. Still in VTAC. Pulses VTAC. I'm charging at maximum. I'm clear. Everybody clear? Shock.
The rhythm has changed.
Continue chest compression. Ventilation for 2 minutes. Looks like a systole. I'll check the leads.
The leads are connected.
Check the pulse. Stop
There's no pulse.
no pulse. And check the gain. Is the gain maximum?
The gain on the monitor is maximum.
Actual asystole. Continue chest compression for 2 minutes.
Yep.
And we'll give adrenaline 1 milligram now for the second cycle. Is it?
Adrenaline 1 milligram,
And 3 milligram atropine and flush it.
3 milligrams atropine,
1 milligram of adrenaline and 3 milligram of atropine given.
So 2 minutes. Tell me when the 2 minutes are over.
Okay, 2 minutes are over. There's change of rhythm.
Continue again, please. Continue 2 minutes. Let me change after 2 minutes to another 2 minutes.
Okay, despite change of rhythm, we continue CPR for 2 minutes.
2 minutes are over.
Yeah,
Okay, stop.
2 minutes are over.
Check the pulse. 1, 2, 3, 4, 5, 6.
There is a pulse.
There is pulse. What's the blood pressure, please?
The blood pressure is 119/79.
Very good. So we said the slide. Now we have to do CTC, urea electrolyte, cardiac enzymes, arterial blood gases, chest X-ray, both leads EKG, and call the cardiologist, transfer to CCU.
Okay, thank you. Thank you so much. Can we have this there? Okay, now we will demonstrate to you the use of automated defibrillator in real life. Okay, let's assume a similar scenario, but outside the hospital, a patient who... No, we don't need it. You want me to do it this way? Fine. Okay, we have a patient who is shopping in one of the big malls, and as he approaches to get a chicken from the freezer, he falls down. The risk here is electric shock. So first we make sure the scene is safe, the electricity is switched off, and we approach the patient. Are you all right? Are you all right? He's not answering us, so we call for help. Help. Okay, we open the airway and check breathing, as we normally do. 1, 2, 3, 8, 9, 10. There's no breathing. Can you please start chest compression? And we call for the ambulance. One of us will go and look in the mall if there is an automated defibrillator. And sometime there will be, inshallah, automated defibrillators in the malls. Okay? Finish 30? Okay. The automated defibrillator has arrived. Now, normally it's not open like this, it's closed. All right? Defibrillator is closed. The first step you do is you open the defibrillator and switch it on. And when you switch it on, it will start talking to you. All right?
Unit okay. Stay calm. Check responsiveness.
We have none all that, yeah?
Call for help.
Chest compression. Go.
Stay calm. Check responsiveness. Call for help.
Okay.
Open airway.
Yeah.
Check breathing. Attach defib pads to patient's bare chest.
Okay, we're in business. When the defib pads, when you open the defibrillator, you will find them inside. If you don't find them, you've done. Okay, or the patient is done. And they have got pictures, so they're very easy to put on to the camera there. You put one under the right clavicle, one at the apex of the heart. So what do you think this is for? Chest compression. All right. We'll put these, and as I said, please, you must take the adhesive off and stick it to the patient. Adhesive off and stick it to the patient, and then you must connect it to the defibrillator. All right? When you connect it to the defibrillator, it will tell you not to touch the patient. Why? Because if you touch the patient, it will cause artifacts. He doesn't like it.
Shock advised. Don't touch patient. Press flashing shock button.
Okay, can we see this flashing shock button here?
Don't touch patient. Press flashing
All
shock
right.
button.
All what you have to do to shock the patient is press this button.
Shock delivered. Start CPR.
Okay, we'll start CPR for how long? 2 minutes. Every 15 seconds, this guy will remind you to continue CPR in case you sleep or you forget.
Continue CPR.
At the end of 2 minutes, he will say stop CPR, and he will analyze the rhythm, and if there's a need for shock, he'll tell you to shock. Yeah? Okay, well, this is the end of the demonstrations and presentations. Now, I would like you, please, I'd like all the instructors to be at the stations. Okay? Those who are sat, please, at the front, stay sat. Those at the back, go to your stations. Okay? You'll be required to demonstrate chest compression, 1 ventilation, 1 defibrillation. You get your form and you go out.